Kate Tobin Carroll, okay, is the first one to speak. It is all alphabetical. She went to, anybody remember what university she went undergraduate? Princeton, exactly. And she majored in psychology and neuroscience. And you'll never believe what Jessica majored in. I forgot that you had a physics degree too. Unbelievable. So Princeton, psychology and neuroscience. She went to UC San Diego for graduate school and UC San Diego for medical school. And then she had a little detour for a few years where she actually worked for a living and did technical innovation with a company that we still work with. She is an R25 recipient. She has over 30 publications, peer-reviewed publications, some of which she's the first author on. And there's lots more. I'm going to talk about Kate at graduation. So without further ado, Kate Tobin Carroll, can you come up here?
All right. Good morning, everyone. My name is Kate. It is an honor to be standing up here today to share my reflections with you on the last 7 years. You know, a little birdie once told me when I was being evaluated as an applicant 7 years ago that there was some concern that redheads wore their emotions too close to the surface for neurosurgery residency. Well, I can say that as you have all witnessed over the last 7 years, that concern was absolutely justified, as will be readily apparent during this presentation, but thank you for deciding to take me anyway. Speaking of Dr. Buckley's talk, I listened to my first set of graduation speeches 6 years ago and heard a talk that I have never forgotten. Dr. Buckley gave a speech not just on the particulars of his experience as a resident, but on the Stoic and Taoist philosophies that guide his approach to life and to neurosurgery, frequently one and the same for Dr. Buckley. We could not be more different as people, but his perspective on how to be a neurosurgery resident has stayed with me. And today I hope to follow in his example and share some of my own philosophy on what it means to be a neurosurgeon. The goal of residency, I think, is to graduate as a safe and competent neurosurgeon. But surely we must aspire to the longer-term goal of becoming world-class experts. And how do we get there? It helps to have some degree of natural talent, but effort actually contributes more than native talent. Effort is required to both build one's skill set and then to use that skill set to turn it into true achievement. Effort and talent, we find, are not actually correlated and can be inversely correlated if one takes one's talent for granted. We have also all heard the research of Anders Ericsson. He stipulated that becoming an expert in something takes 10,000 practice hours. So let's apply that to becoming a neurosurgeon. And let's consider right now solely surgical skill. Surely 7 years of residency must provide ample time to get 10,000 operative hours. Let's see, over 7 years, that is 1,400 hours. Let's assume that you take your 4 weeks of vacation, so that's 48 weeks a year, that's 30 hours per week. And for now, let's say you're only working business days, that's 6 hours per day. But now let's say that during your intern year, you don't actually get into the OR that much. That's 7 hours a day operating. And if during your research year, you don't get into the OR that much, that's about 8.5 hours of operating a day. Now, all of a sudden, those 10,000 hours don't seem quite as easy to come by, especially because it turns out it's not just the quantity of hours that are put in, but the quality of those that are put in as well. Ericsson found that despite putting in the requisite 10,000 hours, some people arrest in their skill development. What set those who go on to achieve expertise apart is the quality of the practice hours. So the question for us becomes, How do we find the motivation to make all of those hours count? Angela Duckworth and her group at UPenn first described this personality trait called grit. The original paper was published in 2007, and she went on to publish her work in a book in 2016 titled Grit. She defines this as passion and perseverance in the pursuit of one's long-term goals. And what this really boils down to is stamina. Her original research studied this trait in many different groups of people, including West Point military cadets, spelling bee finalists, teachers in high needs districts, and salespeople. And what they found was that across each of these different groups of people, the best marker of success was grit, even more so than IQ. Here's the grit assessment. It's comprised of these 9 questions that are rated from very much like me to not at all like me. And as you can see, if you read the questions, the characteristic has more to do with consistency than with intensity. It tries to capture, according to Duckworth, whether someone wakes up every day with authentic interest. Wouldn't it be wonderful in life to find some learning curve that you don't want to drop out of, she says. Wouldn't it be a wonderful thing in your life to find excellence and achieve your potential? People have thought about grit in surgeons before. This paper published in JAMA in 2021 reports the survey results from over 7,000 general surgery residents. And they found that grit was significantly associated with lower levels of burnout, lower levels of suicidal ideation, thoughts of attrition, and was significantly associated with fewer work hour violations, greater satisfaction with the duty hour regulations, greater satisfaction with how much time there is for rest, and with the decision to become a surgeon in general. When these results came out, people started to ask, if it's so important and such a marker of success, how do we cultivate grittiness? This led to identification of research done by Carroll, I believe out of Stanford, on something called the growth mindset, which is seen in children during development. The growth mindset is the belief that failure is not an endpoint, that children have the ability to change the outcome dependent on their effort. And this can be fostered with support. So Duckworth finds that even the grittiest of us in a significant challenge are going to need significant support to reinforce that failure is not the end result and can be overcome. And if there is anything that has carried me through residency, I think it is this. I think it is grit. I will say that while my score sets me apart from most Americans, I'm sure that I am very, very average when it comes to neurosurgeons. My resilience was certainly forged in childhood. Talk about a challenge with tremendous support. I trained pre-professionally in ballet for many years in my childhood. This meant classes 6 days a week for 2.5 hours a day. When studying ballet, you are taught to forsake all physical comfort in the pursuit of perfection. There were many days I would tell my parents that I was giving up, I wanted to quit, I never wanted to go again. And they did the textbook thing to do for fostering grit in your children, which is that they would tell me, that's fine, you can quit whenever you want, but how about you go to today's class, or how about you finish the week, and then we'll talk about it again. And inevitably, at the end of the day or at the end of the week, I'd forgotten all about wanting to quit. I approached most things with the same perseverance, but it took me a little bit longer to find my passion. The first whiff of it was when I went to work for Integra. I worked there for 4 years, during which time I completed a manufacturing process map of the making of Duragen and identified areas in need of improvement. And these are actually a couple, maybe proprietary images of the manufacturing process of that product. I realized during this time that while making the products was interesting, using them seemed far more so. So I went to UC San Diego for medical school, where my interest in neurosurgery only grew, especially as I set out on sub-Is. You can see I really made my mark. I had a fairly singular focus when I created my rank list, and that is because it was becoming clear that something wasn't right with my dad. So I prioritized making it closer to home back in the Bay Area. You can see on my face, therefore, that despite the fact that I ranked UW very highly, I wasn't actually expecting to see that name on my match letter.
Hold on. Whoa! What? What? University of Washington.
She's so excited.
Oh my God! I'm gonna be destroyed.
So if you if you didn't catch that, my initial reaction was, I'm gonna be destroyed. And I was right. Here you can see the look of gleeful terror on my face for much of my intern year, as well as the frequent visits to the emergency department I took. But I persevered. And for me, that is because of our patients. What gets me out of bed every morning are the patients we get to take care of. I spend the 8 or the 9, or I think my record was the 21 hours in the OR during a day, so that I know that I can offer our patients the best possible surgical care. What I found is that the non-surgical lessons that I have taken away from them are often the most memorable. These are intentionally not CT scans or MRIs. But I will never forget the 20-year-old who was admitted with a dissecting vertebrobasilar aneurysm and lay comatose in bed for weeks with this quote tattooed on her forearm. And if you can't read that, it says, "Everything was beautiful and nothing hurt." And being confronted for the first time as an intern with, God, the tragedy of this profession. Or the college student who I got to see walk back into the neuro ICU 1 year after she spent 3 weeks in neurocritical care in a medically induced coma for intracranial hypertension after a freak windstorm picked up a bouncy house that she was in and she fell out of it. I will never forget the soon-to-be grandfather who came in for a procedure and told me he couldn't wait to meet his grandson, only to die in isolation 2 weeks later from COVID that he'd contracted right before his surgery. Or the family of a patient who turned to me and asked, "If it was your father, what would you do?" 6 months after my dad had decided to end his life when facing a terminal illness. It is these moments and these patients that make staying the extra hour worth it. And it is not always easy. Duckworth says that grit doesn't really matter on the good days. It matters on the bad ones. We will all have bad days, and I certainly had my share during residency. When I was an intern, my grandmother died in her sleep of a stroke. I was on service at Montlake. James Bales excused me for the day, but I told him all I wanted to do was operate. So Jessica came in and relieved me as the intern on service, and I went and did a shunt. When I was in R4, my grandfather died of congestive heart failure. I got to say goodbye the week beforehand during a vacation. He was at home in a hospital bed, too weak to move much, but still 100% with it. I leaned over to say goodbye and started to cry, and he said, "Katie, you're getting me all wet." The morning I learned he'd passed, I think I was a little quieter than normal. My chief at the time asked me why I was being so weird. He told me to go home when I told him, and I told him I just wanted to go do my cases, which is what I did. And in the spring of my R2 year, my dad died. He had cortical basal degeneration, and as his disease progressed and he felt the loss of more and more of his faculties, he decided he wanted to die on his own terms. I was able to move a vacation around to be with him, and I went back to work a week after he died. 10 years ago, I graduated from medical school. My grandfather and my father sat in the audience, as they had always done for elementary school, high school, and college graduations before that. I feel their absence very keenly this time around. After my father died, some people asked me if we were close. I never understood that question because I cannot imagine a life in which my dad isn't my favorite person to be around. The tragedy of his death is that his disease deprived him of his passions. He had developed ataxia, apraxia, and aphasia, and could no longer do the three things he loved most: walking, birding, and writing. He was a lawyer by profession, but also so much more. At any given time, he had between 70 and 90 orchids that he tended to and kept blooming year after year. He was a beautiful and prolific woodworker, and he was an exquisite author, publishing almost 20 poems in his lifetime. And these photos, separated by about 3 decades, are of me and my dad both doing ballet on beaches. The hardest challenge of my life was losing my father as an R2, 2 weeks before we entered a global pandemic. I gave up years with him to do this. And he was my favorite, and I don't regret it at all. This life, what we do, it should be reserved for those who can't live without it. The people who love you will understand, but you will be in chronic debt to them. In return for their understanding and acceptance, when you have anything to give, give back and give generously. The day before he died, my family gave me some extra time with my dad because they'd been with him for the past 2 weeks. I asked him if he wished I had spent some more time with him in his last couple months. And he looked at me and he said, "No, you have been the most wonderful daughter." In the same car ride, he then wanted to know all about sterile technique and how to drape in the OR. Everyone in this audience has proved that they can persevere. To the residents, what I implore you to do is to find your passion. Find what it is about this job that makes the sacrifice worth it, because that is what will help you wake up every morning with authentic interest, what will push you towards excellence, and what will keep you from falling off that curve. And most importantly, make sure you have the support to do so along the way. I did. I want to acknowledge a couple of people in particular. Maggie, who bore the brunt of my faltering that spring as our intern on service, never held it against me and was still willing to become my dear, dear friend, even offering me her bathtub last night when I said I needed a little sensory break. My brother Patrick, who took care of everything related to my dad's sickness and death and graciously made me feel like what I could give was enough. And Grace and Sam, who opened their doors to me during COVID and helped me up off the floor when I didn't think I could stand on my own. The 4 of you, thank you for making sure I made it to today, perhaps a little battered, but because of you, not at all broken. And I'd like to end with something that may seem a little antithetical to my talk, and that is this poem from which the title comes. We should have done less with our lives. We should have let ruins linger and delayed the invention of light. We should have covered our telescopes and awaited eclipses, dropped our shovels and let snow fall at night. Water breaks through rock. We should have let it pool like slow glass beside the sky. We should have stopped our cabs and let starlings cackle. Our wings needed stones. Where were the batons for silence and sleep? At the opera, men and women love and die. The orchestra should have played the love aria more largo, and we should have clapped so slowly the death scene never came. And while, of course, this might seem a little counter to the nature of neurosurgery, I think it's integral that we pause to marvel at this thing we get to do, that we sit in stillness with the grief and we celebrate the successes. I think this kind of intentionality and mindfulness is also one of the things that helps carry through that motivation. And this is one of my dad's. And some thank yous to the faculty. Thank you so much for trusting me to take care of your patients. A special thanks to those who have mentored and supported me throughout. To Dr. Levitt, who introduced me to a research topic I hope to carry with me throughout my career and who has stayed invested in me despite my career switch. To Dr. Lee, whose personal and professional mentorship fundamentally changed the course of my life and who I can only hope to emulate in the future. And to Dr. Ellen Bogan, Thank you for seeing something in me and ignoring the protestations that us redheads might be too emotional. Obviously, unfortunately for you, they were right. Thank you to the most wonderful group of co-residents for teaching me, putting up with me, and making me laugh along the way. To my litter mates, you have inspired me so much more than you know. Thank you for always giving me something to work towards. In our darkest R2 moments, Jessica and I got matching tattoos that mean perseverance. And it has been an honor to be on this journey with you.
I cannot get it back.
You want to join? Thank you to my wonderful family, old and new. I couldn't ask for a better and more loving support system. And finally, I always thought neurosurgery was the love of my life. And then my heart grew a little bit bigger. The biggest thank you of all to the one on whose shoulder I found my greatest source of support. I don't know if he's on the Zoom or not, but I can't wait to marry him. Thank you.
Wow, one word, passionate, beautiful. That's two words. Without further ado, Jessica C. Eaton. And I've gone 7 years and I still don't know what the C stands for. I do. I know. I'm just kidding. So Jessica has spent 7 years teaching me to say Louisville. Louisville. Okay, I'm sorry. So I failed. Both Bachelor of Arts, and does anybody remember what our Bachelor of Arts is in? English and physics. Okay, pretty impressive. English and physics, both. She has a very scientific mind. She graduated from Louisville, and she is a Fulbright scholar. Of course, it's being reorganized now, but you have one of the original Fulbright, the way it was intended to be by the Ambassador Fulbright. And she has nearly 30 peer-reviewed publications. And we're wonderful to have you and hear what you have to say.
Gosh. Mhm. 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 I can just do it shared probably. Mhm. I don't need notes or anything. I have my notes on paper. Okay. Yes, okay, excellent. Okay, hi, good morning. My name is Jessica. So I have also been thinking about my end of residency talk for years. I did not make my slides 2 years ago like Kate did, but I have been thinking about it. I like a narrative, I like a theme, I like things to make sense. And so I've been planning, rolling things around in my head, and then changing my mind, which is to say I thought I had it figured out so many times, and then I realized that I didn't. And again, I would gain some ground, I would feel like I understood something and be wrong again, and on and on. And maybe now, that is the theme of this talk, the circular storyline of learning, thinking you get it, and realizing how wrong you are, and then starting again. Perhaps at the very least, one can strive to make the circles that get a little bit better each time, less like a racetrack and more like a spiral staircase. These talks are meant to be a lot of things, but a significant part of them are advice for the people that come after us. That aim feels really important to me, and I think some of that is because it feels like things are really shifting amongst medical training, amongst neurosurgery, amongst our program, but a fair amount of this is not unique to us. I had a long talk with a mountain guide recently who said that the same thing is happening in their industry. Younger guides are more worried about applying sunscreen than helping their clients learn to build rescue systems. The same thing also happens on a reality TV show that I watch where people work on yachts and the older stewardesses cannot believe that the younger stewardesses don't have any work ethic. And then there is this article in the New England Journal that the boss circulated last year. Work like obtaining records from outside hospital is scut work that is toxic. Any negative feedback is abusive, and a long call or a high patient census is unjust and injurious. The authors point out that there is this tendency to take things that don't feel good and call it trauma. Doing 21 consults on a Sunday by yourself, trauma. Operating with fungi for 3 days straight, trauma. Being expected to keep track of the entire list no matter the circumstances, trauma. But two things to keep in mind here. One is that nobody created these tasks to arbitrarily test you. It is just what the job demands. It's what the patient needs. Those consults need a neurosurgeon and you're it. They need spine surgery, and while fungi doesn't really need you, he also kind of does. And knowing the list is not a test, it is literally how we keep patients safe. And while your chief can and will help you, if you're going to do this job, you have to learn how to do it. The second is that all of those things make you better. Every time you see a consult, you see another iteration of the diagnosis that will help you to quickly reference it when you see patients next time. Every surgery you scrub is a rep that makes you better trained, more efficient. Another instance of you seeing the anatomy and building the framework so that you can move around it with a little less effort next time. So I think we can agree that the intolerance of discomfort has no place here. What I will say, somewhat in response to Dr. Koh's admonition to many of us when we were juniors at the UW not doing as well as we could have, 6 months of pain or 6 years of pain, he always says, that the pain, the discomfort is totally inevitable because doing this job well is hard. But while the pain is inevitable, suffering is totally optional. So thinking back on 7-8 years here, I aim to do a couple things. The first is to talk about how to be the best you can be at the end of them, since that is indeed the point. And the second is to think about maybe how you can adjust your mindset to minimize suffering. So let's start here as an equalizing measure. You are probably here because neurosurgery suits you in some way or another. This is like the thin thread that ties all of us together. We're a diverse group, we know that, but there is something in all of this that makes neurosurgery make sense to us individually. When I was a med student on my 3rd-year rotation, I said I would go into neurosurgery, and Dr. Nada told me to lay down on the floor for a while and see if the feeling would pass. I think most of us ask ourselves that, and the feeling does not pass. My mom tells this story about me being a toddler and coming into the room and finding me standing over my brother's head with a butter knife saying I wanted to know what was inside. I think she probably made that up. But there is some interest of the brain, of the spine, that thing where the nature of the job is really demanding, where you have to work hard because there is no one else. I love that. I thrive in an environment where I'm needed. I like the pressure of being the only one. There's maybe a love of emergency, of working with your hands, of the eloquence of the neuroanatomy the first time you learn it in medical school. That's the starting point. And then what? So then, advice to be the best you can be and to minimize suffering. There are some pieces of advice that are good or important, but you've probably heard them before, maybe even from me. We talk about noticing what the first thing the attending does when they sit down at the microscope, because that's the thing that you were doing that you needed to tweak. About keeping detailed operative notes and embracing the step-by-step, same way every time approach to an operation. Every neurosurgery has 3 steps. Each of those steps has 3 steps. Writing things down, having a system for maintaining a Harborview Junior list and not being afraid to start over and make it better. Collecting videos of yourself operating and making a library of the things that you know how to do. And always taking the standard 3 views, photos of the positioning, not only so that you have them for the next time you do the case, but also in case your attending asks you to prepare for publication. And maybe most importantly, don't keep your trauma M&M list on a crumpled piece of paper at the bottom of your work bag for a year before assembling your slides. These things are good and important, but I would say that there are some more esoteric things that I had to learn rather than what was taught to me, and I thought I would try to work through those. I hesitate a little bit because I'm not totally sure that my experience is universal, and maybe some people need these principles less than I did. But I can only tell you what I know, and what I know for myself is this. If you want to be the best that you can be at the end of residency, you have to let it matter more than anything else. You have to let it hurt you, and you have to change in response. So it may be difficult for some residents to hear that neurosurgery has to be the most important thing in your life. It's likely even harder for your significant others to hear that. I'm going to provide a lot of caveats that will hopefully make that more okay, but at the end of the day, you did come here and dedicate your life to something pretty serious. More specifically, you signed up to commit to 7 years of training in that pretty serious thing. But instead of starting with how it makes you feel to have things more important than X, Y, or Z in your life, let me ask you to start at the other end. I would just ask you to put yourself in a patient's shoes for just a minute And imagine trusting yourself or the loved one to the hands of a surgeon. How crucial is it to you to be able to know that the surgeon is the best that they can possibly be? I've been thankful many times over the years that when I go to mark a patient or show them the images of their tumor for the first time and they look terrified, I can honestly say that Dr. Ellen Bogan or Dr. Ferreira or Dr. Kim or Dr. Ko or Dr. Zhang is absolutely the best, and we will take very good care of them. They could not be in better hands. For me, it will not be acceptable to not be able to tell those patients that they are in the best of hands when I am their surgeon. So how do you get good enough? 7 years is a long time and a lot of things happen, but also 7 years is so finite. You have to understand that it won't happen again, that this is all you get. So as I said, there are some caveats. Things will happen that are not repeatable, that you can't reschedule. You have a baby or your dad dies or your appendix ruptured. And now is the part where I use a climbing metaphor. I made a decision not to make the whole talk a series of climbing metaphors, although I think it would have worked, and I did think about it because I started climbing when I was a 3 and I learned a lot from it. In any case, this one I think does work really well. So when you're climbing, you sometimes have to build an anchor around rocks in the snow on an ice wall maybe. Sometimes it's a measure of protection in case you fall. Sometimes you have to put your whole weight on it. Sometimes you have to use it to pull other people up. So these are the principles of building an anchor. It has to be strong, redundant, efficient, equalized with no extension. The concept is that it has to be this way for 2 reasons. The first is it distributes the load in normal circumstances if it's equalized and efficient. But also, if a part of it fails, it will be okay because it is redundant. That's the way I think about the resident team. If you're contributing to the strength of the anchor under our usual circumstances, no one will hesitate to catch you when you need it. When it breaks, it will work. Importantly, there are a lot of ways that you can mess up an anchor when you're building it, in the same way that a lot of things can disrupt a culture of a program that is usually so reliable and comforting in its best form. It is on all of us to make sure that the anchor is built properly. So that I think is the caveat, and then let me address the rest of it. For the non-reproducible 7 years that you are here training, it has to be the most important thing that you do. For a very simple reason, the goal is to be the best you can be at the end. And if you waste any of that training, you are wasting opportunities to be better, and you have to accept that without resentment. You're going to miss dinners, holidays, evenings at homes, trips that your friends take, weddings that you wish that you could have attended. It means coming back to the hospital if something went wrong, giving up your Saturdays to go to courses, staying up to read for tomorrow's case when you'd rather get some sleep. I think most of it begins with how you think about your role here, because the fact is that for the most part, you define your own job. There are a few truly set things about our individual resident roles, but I would encourage you not to carry yourself as the trauma junior or the vascular chief or the angio resident, but to simply carry yourself as the neurosurgeon of the patient you are taking care of. From there, it's pretty easy to know what to do. The surgeon thinks about the case ahead of time, they strategize, they set up the case, they position the patient, they check the microscope, they review the surgical plan with the team, they see the patient afterwards, they follow up their labs and their images post-op. It's not always possible to do this completely sure with all the demands of the actual service, but I think that mindset is a starting point and a set of values that you should aim for. It's not a small thing, I know, but that is kind of the point. And when you get tired, remember, you only get so much training. This is the mindset shift that I think will minimize suffering, because if you approach your training this way, you'll be doing as much as you possibly can, and there's no one to resent because nobody is making you do it. In fact, it's not that you have to do this at all, it's that you get to do this. Doing neurosurgery is a privilege. So on to my unique brand of neurosurgery, of insecurity, sorry. I'm somewhat obsessed, I think most people know, with becoming a really good surgeon. Technical ability has always been the focus for me, sometimes out of proportion to the rest of the job. I've made steps towards that really, subpial dissection, fissure splitting, dissecting out tumors and aneurysms on my own at the microscope, reducing and fusing thoracic dislocations, optic canal decompressions and clinoidectomies, and on and on. And yet throughout residencies, I have had complications that are attributable to nobody but myself. A lot of them, I'm afraid. Even as I got better, I felt things would still happen. How is that acceptable? It felt or feels like a problem other residents might have, sure, but it felt like some of my natural tendencies really magnified it. Because of my brand of insecurity that I referenced earlier, I carried those things in a really heavy way. It felt like an inherent part of me that other residents didn't have to deal with. In some of my worst moments, I would call Caroline Hadley, my peer mentor and overall muse, and she would answer the phone with, "It's Thursday, what did you do?" Thursday being Dr. Ferreira's big operative day. It occasionally felt like there were runs of time where I couldn't get my hands around it. I couldn't be as good as I wanted to be. This would start an insecurity thing in my head. Other residents, it should be noted, are not from Kentucky, did not go to state school, are not from schools with then weak programs, are not from families with no exposure to healthcare, are not like me. I am an outwardly very confident person, yes, but inwardly a part of me has always feared that this is not a place where I belong, not a thing that I can do, not a dream I have any business having. This is where I will say, feeling like that was really difficult, but it was not a bad thing. You have to let residency take its toll on you. A lot of the times, the reasons that something bad happened was because of things that happened because of my inherent weaknesses as a resident. This is a thing that is true of all of us. We have some soft spots that make us less than ideal. You can probably ask any attending in this room what mine is, and they won't have to think very hard before they say, she lacks attention to detail. I also sometimes am a cowboy that shoots from the hip without thinking too hard, and I move faster than I think. These things are overcomeable, we'll get there, but at the time of the complications or the mistakes, it just really causes this feeling deep in your chest that you're not good enough to do what needs to be done, not capable of not fucking up. So when I was a junior resident, Dr. Rapport sent me an essay that he wrote. When I was a sub-I, we had bonded over literature, Wendell Berry specifically, who hails from the same county as my parents and shares a publisher with his wife. So he sent me this essay, Learning to Drive by Yourself. It's about his experience training us in the patterns that he saw. I think about it from time to time, have told other residents about it, and I looked at it earlier this year and saw these two lines. Occasionally there have been tears, always they recover. At the risk of really ruining my hard dog public image, I will tell you that I myself have cried or nearly cried in the offices of no less than 5 attendings. The first time I was a 2, I made a mistake during my overnight call fairly early on that year when I was trauma junior. The next day, an attending told me that he knew that I understood the mistake because I looked like I was going to be sick, and he told me that his chair was more comfortable than mine, and he would be gone for at least half an hour because he needed lunch, and maybe I should take a moment. Occasionally, there have been tears, but always they recover. So here's step 1, just keep swimming. One time when I called Caroline and we were working together through the mental gymnastics of continuing on, even of what it takes to will yourself to go to work the next day when carrying the mistakes feels really awful, she told me that residency is like the forced swim test, in which researchers know that a rat is only truly depressed when it stops swimming in a circle. So when things start to get difficult, the first thing is to keep it together enough to just keep swimming in the circle. Just don't give up for a bit, and then you can try to move forward afterwards. So what do? A few things that I myself do, and then a few general guidelines. As you know, I call Caroline. I walk, or when I'm worn really thin, I sit in quiet places in nature. I breathe and I write until I understand what happened and how to be better. I plan climbs and I train because the structure of a training plan and working towards a separate goal is really good for me. In more general terms, you need to have people, you need to find ways to process, and you need to manage your feelings. In general, I think you need 2 types of sounding boards. You need peers that think of neurosurgery the same way that you do. This part is important because not all residents are the same, and sounding off to people that don't value the same things as you is frustrating. The other type of sounding board you need are people that are senior to you, that you trust, that will give you the space to work through while you process. Chiefs, fellows, attendings, fellows or former fellows in your specialty are really great for this. They can help you understand, but can also help you strategize how to move forward. But do not discount the processing. These things do not just happen, you have a hand in them. Think about how you can be better next time. Think about how you can be more strategic to prevent variations on a theme from happening. Hold the weight of how it makes you feel so that it does not continue to happen. And finally, I would posit that one of the most useful things you can do is manage your feelings in an effective way. The most important aspect of that is that you need to understand that your feelings don't dictate the situation. To state it plainly, you have to remember the context in which you are working. You are being allowed to do some part of a surgery that the attending was trusted to do as well as they possibly can, and some part of that was given to you. When things aren't as good as they could be, people will be upset. When the shoulder is in the way the entire time they are working at the microscope because you didn't position well, people will be upset. And sometimes when you do nothing wrong, but something bad happened to the patient in the other room, people will still be upset. The first step in learning to be a snake charmer is to make yourself immune to the venom. And the first step in learning to be a good surgeon is not falling apart when you are criticized. I think it actually becomes harder as you become a more senior resident because you get defensive about the fact that you start to think that you're capable. But being defensive is not going to gain you anything. In fact, it makes you closed off so that you can't learn, and that's hurting no one but yourself. A simple way to think about it is having thick skin, but it's a little more nuanced than that because you can't not care about the criticism. But you can manage your feelings. Try to be objective about what you could have done better, write it down, and then next time do it. And there is always something that you could have done better. Be grateful for the surgeons that care enough about your training who believe that you can do this job to tell you how you could have done better than you were today. And so to the change. It's not supposed to be a comfortable thing. We are training, trying to learn things that you didn't know before, trying to master techniques that you couldn't do before. And so you have to change into someone who can do those things, and change is uncomfortable. They require some sort of effort, some sort of pressure. It is frankly really hard, and it doesn't feel good a lot of the time. I've addressed this somewhat already in this specific sense, not making the same mistake twice, doing a technique better each time you do it, but in a more esoteric way that I've been thinking about this recently. I feel like I am such a different person than I was when I moved here in 2018. I think a willingness to change who you are is important. To some, maybe this seems intuitive, and for some, maybe this is less true because you have more natural traits that are conducive to being a good neurosurgeon than I did. But I came here pretty attached to what I saw as my personal identity, and I really struggled against changing for a long time because it felt like it was betraying myself, but it actually is not. What I mean is that there are some ways you need to be in order to be a good neurosurgeon, and you cannot let the natural tendency of yours hold you back from being that good neurosurgeon. I said earlier that everyone has their soft spots. They're little things that are less than ideal for someone that does this job. And the change I'm talking about just means addressing those traits in yourself. I lack attention to detail, so I systematically check everything myself and I write it all down. I'm inherently a little messy, so I overcompensate with that by being very inflexible about the way I do surgery and trying to be pretty neat about it. And I move and talk faster than I think sometimes, so there are moments in my day or specific tasks that I know require extra concentration on my part, and I adjust my pace for those. I am a lot less laid back and a lot more disciplined than I used to be, and I think I'm a much better neurosurgeon for it. Which allows me to segue into one final thing: patch up those soft spots and manage your feelings, but of course maintain the things that got you here, because those certainly exist too. As I said, neurosurgery suits all of you, and you come here with strengths that will give you an edge. You also come here with values and support that you need to hold on to as well. I referenced my upbringing as a source of insecurity earlier, but I would be remiss if I didn't acknowledge it as one of the best things about me too. My mom does whatever she wants at all times, and seeing her do that taught me that I could too, including being a neurosurgeon. And no one has ever been as proud of anyone as my dad is of me. My siblings too have always offered an unconditional love. I'm so thankful for all of them, and to have the privilege of coming from where I come from. So thank you to the boss, to every single one of the attendings for putting up with my nonsense and teaching me so much. I've learned so much from all of you. I couldn't begin to put into words how much it all means to me. And finally, to all my co-residents for being my people when I needed you, and for a lot of fun times. I couldn't be more grateful for all of it. Thank you very much. Oh, Pam's gonna switch computers, I think.
Oh, wow. Great, Jessica. That was insightful. All right. Last but not least is Jimmy Pan. I know it's James. James Pan went to Carnegie Mellon University, and he earned honors in both biology and chemistry. And he went off to Stanford Medical School, where his concentration was in informatics and data-driven medicine. No surprise there. Again, somebody with over 20 peer-reviewed publications. And he was a very memorable resident, like his two partners. And Jimmy, come on up and tell us what you're going to say.
Hello? Okay. That was an unintended preview. Okay. Is that okay? Megan, is that okay? Okay, so this one's muted. My thing is on. You can hear me? I think people can hear me. Okay. All right. So the title of my talk is Never Let a Good Crisis Go to Waste. And that's one of my favorite quotes from Dr. Ellen Logan. It was thought to be originally attributed to Winston Churchill, but I think he got the inspiration from Dr. Ellen Logan. So, I'll be talking. Thank you so much for having me here today. I'll be talking a lot about. I think my talk is going to be a little bit less about myself, but more about what those 7 years meant to me. I think a lot of people around me who shaped me to be the person I am. Experiences that I found very fond to my personal and professional development. And I'm going to mention a lot of you by name here, and I apologize in advance, but I only do that because you're someone that meant a lot to me for the past 7 years. So this is the first picture I took of Seattle from the airplane while I was flying in after I just graduated medical school. And I remember the very next day we had the graduation, and that is where I met my so-called litter mates. I know this is not the first time you've seen this photo today, but I think the one thing that this photo captures best is the look on my face. That is the embodiment of, oh shit, what did I get myself into? So I think the graduation happened on a Saturday that day, and the very next day was my first day at work, and then I went to work. And of course, there's all these people on the list, kind of a deer in headlights look. I don't think I left the hospital for 48 hours. And I really have to give a shout out to Jake Ruzovic, who was my buddy then, who stuck it out for me for 48 hours, although he didn't have to. I remember calling him in a panic for a bleed in the ED, and I was like, Jake, where are you? And he's like, well, I'm walking my dog in Volunteer Park. Can you can you hold them off until I get there? So thanks, Jake, for sticking it out with me. But that's kind of the whole story of the first couple of years of residency. Was a lot of these, oh my God moments. Like, what do I do? You feel like you're in the thick of it, and you kind of just have to power through and realize what you learn on the way. So the next kind of example thing is, it's gonna be a lot of exaggerations here, but I think hopefully this will make the point. So as for all the junior residents in this room, let's say you're on call at Harborview. Saturday night, it's busy. A lot of trauma's coming in. You got a ruptured aneurysm, you got an EVD to place. Nurses are paging you, like EVD is malfunctioning, getting paged by the transfer center or families, and then you get this text. And then, oh, what could it possibly be? And then you open the text and it says, I have a hot potato coming. And then, okay, all right, okay, we'll deal with it, right? I need you to get an inpatient myelogram and DEXA scan by tomorrow. And remember, this is a Saturday evening. And book the patient for a T10 of pelvis, starting at 3 in the morning. And it's these impossible moments through our residence that really teaches you that sense of resilience, that sense of how to get things done. And sometimes you just have to think outside the box. Now, specific advice for the junior residents, I can't tell you exactly what you have to do. This is stuff that you really just have to experience it to really learn how to do it. And I think it's these kind of experiences that really shape us, graduates of this program, into who we are. In the face of adversity, in the face of crisis, we always come out stronger, and we always find a way. And so that's one of the things that someone like Dr. Zhang have taught me. Other things in the operating room, he's taught me how to do a T-lift in 30 minutes. He's taught me how to place cervical pedicle screws, surgical techniques which I thought were impossible. But I think the more important thing that someone like Dr. Zhang taught me is some soft skills outside of the OR and how to succeed in the hospital. And here's what they are. Book everything, put pressure on them. And then the last two are kind of my own reflections on what he taught me is bribe them. You'll find out who them is later, and confess to your crimes. So book everything and put pressure on them. I think that's a thing from neurosurgery. I think, being in such a high acuity field, so many things going on. Unfortunately, a lot of people, not everyone around you has a sense of urgency that you have, especially dealing with a lot of the critical pathologies that we do. So I think it's prudent upon yourselves to show why you care to people around you and inspire those around you to help you get your work done. Bribing them. I think by now you realize that them is the OR front desk. So sometimes you got to bribe them with food. Sometimes you have to bribe them with friendship.
Look at this, a treat from James Ken. He's trying to kill me because he knows my butt doesn't need to grow any bigger. James.
So I think what I realized from here is that to really set yourself up for success, it's the people around you that help you do so. Yes, you have to know like how large your pedicle is. Yes, you have to know your anatomy, your sulci and gyri and all that. But I think when you're actually in the operating room, the people that really set you up for success, the people that help you take care of the patient is, your scrub tech, the OR nurse, your anesthesiologist. So don't forget those people, the people around you that really helped me kind of turn from a deer in headlights person to being successful to where I am today. The next thing is confessing to your crimes. So it's kind of an inside joke between myself and Jessica about like, who's committing what crimes and whatnot. But I think the point I wanted to make there is when I was a junior resident, I don't think I was as self-aware as I am today. I think I brushed a lot of complications under the rug. Oh, that doesn't matter. Like we just move on to the next thing. I think a lot of it was just a little bit of immaturity, but also the fact that you just didn't know what to do. But as I matured, I think reviewing your complications, talking about things you did wrong, I think that comes a long way. And for example, me and Fungi started a crime thread where I tell them about all the bad things I've done. Like this one where I fractured a pedicle by hammering it too hard. Zaroon eventually joined in on this crime log as well and said she stuck a cob through the L5S1 interspace, sometimes with very humorous consequences. But I think it's this kind of reflection, a little bit of self-humor as well. That's what, that's what you grow from, and that's what makes you better. Now, we became very hypersensitive to our own crimes. I think a lot of my junior residents, we became very open about talking about what we did wrong and how we can do better. But at the same time, it also had some other unintended consequences. We also became very hypersensitive about everything else that went wrong in the hospital, like the ED. Unfortunately, that day I had other things on my mind. It's actually funny because I think we became so hypervigilant with all these things that we started to write a lot more PSNs. In the past, PSNs were only written about us, but then we decided, what if we wrote PSNs about other people? And one of my junior residents wrote so many PSNs that she won an award from the PSN people. So congratulations, Fatima. I think the most important thing out of this is that, so you got to build your brand. Now, the thing is, as we went along, I thought, being hypersensitive about everything we did wrong, I unfortunately lost sight of the fact that we do good sometimes. So this is a text that Rob Bono sent me a couple of days ago where he asked me about a patient, were you taking care of so-and-so? And I said, sure, yeah, I overlapped with them. And, I saw him in a clinic a few months ago, he's doing well. And then he's like, who else had him? Jess or Kate? And then I was like, oh, I think they both had him. I was like, why? Was a crime committed? But surprisingly, no, he's actually doing great. So I think, in this pursuit of hypervigilance of everything that could go wrong, I think I swung a little bit too far in one direction and lost sight that, we as neurosurgeons, I think we do some really good things for people, and it's always good to keep sight of that. So moving on. there's one person I wanted to talk about that had a lot of influence in my training, and that is Dr. Lalagam Shaker. It's not a surprise that I had my struggles throughout junior residency, and during some low times during my training. Dr. Shaker reached out. I was a PGY2 at the time at Harborview, and he took an interest in me, and I thought, oh God, why would world-renowned cerebrovascular surgeon, one of the best in the world, like be interested in someone like me? So we met, we talked. He really inspired me to inspire a love of neurosurgery in me. I think a lot of what we had in common was we just loved being in the operating room, and we just loved technical excellence. We loved manipulating the instruments. We just like to get things done. And over the course of the rotation, we talked, we got pretty close. And I remember one day we sat down and then we started to talk about research. And he knew that, I came from a tech background, and he loved his robots and AI and all that kind of stuff. And we talked about, what are some things we can work on together? So we talked, and after a while, Sheikh said to me, James, I need you to build a robot. Okay, well, robot, I think that's reasonable. We'll find something that, people are interested in. And of course, it had something to do with, vascular neurosurgery. So the robot needed to automatically select the correct aneurysm clips. Okay, I thought, okay, well, computer vision, AI, all that kind of stuff, sure, we can make it work. But of course, Sheikh is larger than life, and but I have to say, I've actually been working on this for the past couple of years, and if Dr. Shaker is here, I'd like to present to you the first iteration of ShakerBot 1.0. We've been working on it for the past 5 years, and I think we'll get there. But to give you a sense, the first iteration of ShakerBot could only place pedicle screws. That's the only thing I taught him, which isn't very helpful. But a year later, Zach split his first fissure, and that's something that I was very proud of. And the message I want to send to this is, take an interest in your junior residents. I think I'm very proud of every one of you, and especially seeing those milestones get into these places. I think that is one of the biggest highlights of my training, is seeing people that you work with succeed. So to Dr. Shaker, I think in 2 years, when Zach is your vascular chief, I think you'll be perfectly capable of reading your mind, as a good chief resident should do. And just be careful, he might replace the whole bus. So some other milestones of my junior residents that I've been particularly proud of. This is Julian splitting his first fissure as a PGY4 on a weekend, while also taking junior call at the same time. This is Malia. She somehow convinced Dr. Zhang to do an elective cranioplasty on a Saturday at Harborview when he wasn't even on call. Eliza getting her face and hands dirty for the first time. As you can see, I wasn't particularly impressed. The friends you make in the operating room will always stick with you. We call ourselves the non-essential people posse. And I think one of the most memorable moments at Harborview was my last 2 cases with these 2 incredible surgeons. On the left is Dr. Christoph Hofstetter, and on the right is Dr. Zhang. That had a profound influence on my training, and one of the reasons I went into spine surgery. I think Dr. Hofstetter is just a technical master, true innovator, trailblazer in minimally invasive spine surgery. And we've also worked on some entrepreneurial aspects together, and that's really inspired me to do things more than just the clinical aspects of our field. There's 2 memorable quotes I have from Dr. Hofstetter and Dr. Zhang. From Dr. Hofstetter, it's very practical for a spine surgeon. And the quote from Dr. Zhang I'd like to share with you is a little bit more applicable to the rest of life. So I'll take a little shift in gear here. I'll tell you about a personal experience that I had that was a personal crisis of mine, and how we decided to make an opportunity out of that. So the date was September 27th, 2022, it was 9 a.m. It was a weekday. I believe I was doing subdural with Rob Bono at the time. And then I get a text message from my mom. And I kind of knew what was going on, but I opened the text message and it said, your dad had an MRI last Friday and then he has a brain tumor. And especially as a neurosurgeon, I think that hits down pretty hard at you, and you're like, oh, what could it be? So I step out, collect myself, try to figure out what it is. And at that moment, I remember, all these departmental crises that we went through, whether it's COVID, staffing shortages. I remember Dr. Allen Logan would always put us in a room, we'd have a talk, and he'd always show us this video. And this video of, this plane getting built in the sky and, how, despite these challenges, you just have to move forward and build it on the go. So Dr. Allen Logan, this is my 2025 reimagining of that video. This is neurosurgeon Churchill building a plane in the sky. So I went into that mode, and of course, the first thing I did, I asked my mom, "So can you tell me what was in the MRI?" And of course, she just reads the report to you, and all I hear is posterior faucet and brainstem. I'm like, "Oh my god!" So they sent me the MRI. I eventually take a look at it, and at first I was like, "Okay, sigh of relief." Okay. And the second thing I think of is this just brings me back to my PGY2 Tuesday afternoon conferences at the UW. And my mom asks me, what do you think this is? And of course, it could be an acoustic, it could be a neuroma, it could be a meningioma, and so forth, kind of run through those questions that you ask. So the message to the junior residents is, sure, these Tuesday conferences can be intimidating, they can be daunting, but the questions that are asked of you are going to be the same questions that your patients ask you, are going to be the same questions that your family and friends ask you. So just don't forget that there's always a meaning in some of the more seemingly mundane things we do. So the next thing I did was, I got to find my dad a neurosurgeon. So I looked around, I emailed some people, and I realized, number one, find a good neurosurgeon. Number two, when you talk to the neurosurgeon, have a solid consult question in mind, because I know how annoyed we get when we get these vague requests. So I'm actually called up Rajiv Sen, because his family's in New York, and then I sent the older Dr. Sen an email, and we got him taken care of. He went for surgery. Everything went great. This is a picture of my dad and I right after surgery. Also, the older Dr. Sen. And for the skull base aficionados here, that is a House Brackman grade 1 facial, no palsy. So he did great. The kind of humorous effects from this is that, after he went through the surgery, I just started getting a lot of more questions related to what I do for my parents. So this is a text message from my dad a couple of months later. He sends me a bunch of MRI scans with a structure circled on there. I was like, oh, great, okay, back to PGY2 conference, except this is for my parents this time. And then his question was, my friend had the same tumor as me, but after surgery 4 months ago, he feels dizzy. He sent me these pictures. His question is the white spot causing dizziness? So of course, I politely responded, that is the superior sagittal sinus. So I think my lesson here is that, I think the neurosurgical family that you make here definitely affects your real family outside. So, I couldn't be more thankful getting to know the people here and having them take care of me both in the hospital and also out in the real world. So kind of get to a close. I think the point of my talk is that, you will have adversities, you will have crises throughout your entire professional and personal life. And I think this is the perfect place to really, keep you hardened for whatever comes your way in your career, in your personal life. So just make the most of it. And when the next crisis comes, be like this guy. All right, so I think that's my cue to finish up, but I think the real quote I want to end with was another quote from Dr. Allen Logan, and I think in the spirit of wrapping this up, I just want to say, I love you all, stay the way you are. Thank you.